Sandra, good to have you on. How are you feeling?
Really good, really excited to be here. How are you?
Yeah, really good, really good. We have a lot of things to talk about, and I'm super excited to be talking about some of the super interesting topics, some controversial, but I think it's super crucial to sit down and talk about exactly what's going on right now in the society, in relationships, from addiction point of view to trauma, from one viewpoint to another. So shall we dive right in?
Let's go.
Excellent. So before we actually start with the questions, can you please give everyone a quick summary of exactly what your background is and exactly what you do right now?
Absolutely. So I am a counselling psychologist, as you know, but obviously the audience does not know that. So what that means is I try and help people with their biggest struggles. So whether they're going through trauma, whether they're going through like a life transformation, whether they are suffering from like an addiction point of view, couples counselling, so relational issues, I am the expert in that field. So that is what I do. I've got my own clinic. I've got one in London, one in Dubai, one in Marbella. So yeah. Call me the global therapist.
Global therapist, I like that. So when it comes to people's mindset and the outcome of their life and exactly what they're suffering with, whether that's physical, financial, emotional, I personally think that a lot of that weight actually falls on the people around them in terms of proximity. So proximity then would influence their thought process, which will subsequently drive their behaviors and actions. What impact, in your personal and professional opinion, would negative people and toxic people would have on your personal life outcome?
On my personal life outcome, or in general?
On people that you see. So for example, when you're consulting your patients and when you are building someone's picture, like the causal effect of what's actually gone wrong in their life, how much of that would you contribute to toxic people around or toxic behaviors around them?
Absolutely. So I call it all toxic influences. So that gets classed into toxic people around, social media, the way they've been also brought up, the way their job influences are, anything around that can influence somebody's traits. It can influence how they function mentally, how they function physically. So going back to your question in terms of how does that all come about is when you are surrounded by these negative traits, it will have a massive impact on you. It will have an impact on how you relate to that person, how you relate towards others, and what the outcome of that is. So if you're in a relationship, let's say, where you are with somebody who starts off saying, little small digs, let's say, that really knock you down, that brings down your self-esteem, that doesn't boost you any further, that will then develop into another trait. Possibly, let's say, somebody who is around somebody like that might then start drinking alcohol more. They might start developing anger issues. They might start becoming traumatized towards certain situations. They might become avoidant, in fact. So there's so much that I can talk about toxic relationship and toxic traits and toxic influences. But I think you really need to protect yourself from those things. So anybody out there who does have an influence like that in their life needs to really look at themselves and think, is this actually something that I want to put up with? Is this something that I should be dealing with? Or do I need to make a cutoff point?
That's really interesting. And talking about just reflecting on your experiences and projecting onto other people, what would you say is the number one reason to build resentment in a relationship? That could be mother and father relationship. It could be in a spousal relationship. Could be son and daughter. It could be anything. But what do you think number one factor for that is? And also, how do you navigate bringing the previous relationship in a relationship capacity, resentment? How do you prevent that coming across into your new relationship?
I think to answer your first question in terms of resentment, if you are really resenting somebody, and even to be honest on a minor scale, like let's say 20%, right? It's really hard to navigate that because it's that unspoken emotion, feeling that people are not talking about, right? So in order to kind of like overcome that, the best point is you need to speak to your partner, especially considering we're talking about relationships, whether it's a mother and a father, children, or whatever it might be. It needs to be spoken about. Now, where the danger zone really is if that other person doesn't actually change or wants to hear what it is that's bringing out that resentment in the other person. And I think that's where the danger kicks in, because people become defensive.
Yeah.
They become angry. So sometimes it's easier said than done to say, in this relationship, let's just cut ties. But when it comes to somebody who has been, let's say, 20, 30 years together, parents as an example, you know, it's really hard to then say, go and part your separate ways. It's not as easy as that. It needs to be a sit-down conversation. It needs to be worked out between you two. If that doesn't work, go and see a psychologist together. Talk about what is it that person's bringing out in you, right? The person who feels that resentment, the person who feels that resentment towards somebody. So it's all about speaking, really. And I think the best way of doing that is always try it first. And if that doesn't work, definitely therapy.
And not a lot of people are receptive to therapy.
Yeah.
Because they are not receptive to opening up and showing the inside, because inside is very painful. It could be child-related trauma. It could be previous relationships. What would you say to someone who is listening to this, and this person is like trying their best to get their partner to a therapy session? They're trying to make things work, but their partner, they are just not receptive to it, and they just don't see value. So how do you actually suggest for people to take that? I mean, what's the approach there? Do you just pull the plug, or do you still, there's still some kind of strategic implementation they could have, where they can look to drive that person's behavior into wanting to actually, and go and explore this route of therapy?
That is such an interesting question, Sam, and I think that's probably my most asked question as a relationship counsellor especially. I get constant emails daily saying, my partner needs therapy, we need therapy together, but they are not receptive to therapy. What do we do? You can't force somebody to come to therapy. It has to come from them.
Yeah.
Now, the advice I always give to clients, or to anybody who wants to hear this, is if you feel that that person needs therapy, start with yourself. Go and attend therapy on your own. Let them know you're attending therapy if you feel comfortable with them, or start working on whatever issue it is, but on your own. Because when your partner starts to see those changes, they might want to change themselves as well. And they might be open to the idea of therapy. It could also be that they actually find it, daunting initially. And therefore they don't quite understand, what is it? Why is it that my partner's asking me to go for therapy? So again, that lack of communication is very common as well. So be transparent with your partner. Say, hey, this is something that I've been thinking about. What are your thoughts? Let's have an open conversation about this. They might shut it down the first time round. They might shut it down the second time round. But when it's something that gets mentioned a couple of times with breaks of intervals in between, trust you me, at some point they will engage in therapy.
Because the first, second, third time, it might be emotional, defensive reaction, which can then fizzle out as they start to see positive reinforcement of behavior change, which is going to benefit them, so they will be more receptive to. That's a really good point.
Spot on.
We've known each other for a really long time, and I've spoken to you about this, where you have seen someone incredibly happy, at least on the outside. A guy's super happy, girl's super happy. They're heading towards a good life in terms of their future projections. And I've experienced this from you, where you would say, that's not going to work. In what kind of things are you subconsciously, because you've been doing this for such a long time and you've extensively studied this, what kind of things what kind of markers are you seeing between couples that you could actually predict a failure of a relationship so early on?
Do you know what? That's such an interesting question, Sam, and I actually love that question at the same time. What it is for me is body language. How, when I see a couple or friends come through my door, or we go out for a meal or whatever it might be. I mean, I don't go out for meals with clients, but let's say from a friend's perspective.
Sure.
Especially then, I will be watching them for the first couple of minutes. Unintentionally, to be honest. It's not, you know, coming from anything but a natural instinct that I've got. And you can tell immediately on both their faces whether they're walking in together happy or whether they're walking in together after having an argument, after the energy's not matching. I get kind of like a gut feeling as well a little bit. But for me, it's how is that communicated in the room? So perfect example, when I go out with friends and I notice immediately one walks in first and then 5 minutes later the partner turns up. Whether it's the male or the female, it doesn't matter. It's why haven't they walked in together if they came together? Immediately start to pick up on that.
Yeah.
So communication again, number one crucial point. If people are not communicating, that is where I pull the plug. How is this relationship going to work? Body language. If one of them is constantly very tense, not open, right? Again, number two in my opinion. Number three is what do they bring to the table when I'm having a conversation with them? Who is the speaker in this? Are they bringing their partner into the conversation, or are they shutting themselves away from the conversation? And the partner might be next to them or opposite them, but it doesn't leave any room for them to speak. Again, all of these things are red flags for me. Because if they can do that externally, imagine what goes on internally. Internally at home and internally for them.
Yeah, that's super crucial. So you're picking up on micro expressions.
Absolutely.
And they could be down to their tonality. And I've seen this sometimes where there's a tone of resentment, or there's a tone of it's not driven from a place of love. It's not coming from a place of love. It's coming from a place of resentment or some level of even hate sometimes towards their other half. And you're like, you may need to address this at some point, because this is only going to become a big monster from a small insect that you're not addressing at the moment.
Absolutely. And it's so hard because people will try suppress their emotions, the emotions, what they feel, but also what they feel towards their partner. And then it will erupt like a volcano. And when that happens, that's the danger part. So that's when fights happen, arguments happen. You know, it can go really extreme. So you have to be so careful. It's the best advice I can give people, and I say this day in and day out, is when there is a problem, no matter what the outcome of that problem will be, communicate that with your partner. Because if you can't talk to your partner, you are in the wrong relationship.
Yeah.
I understand there's certain things you might not want to talk to your partner about, you know, funny things or things like, you know, today I need to go and get a wax done or whatever. Okay, fine. Keep those things confidential or private.
Sure.
But when we're really talking about what eats you alive from the inside, you need to have that conversation with your partner. And if you can't have that conversation, you need to ask yourself, what am I in this relationship for?
Yeah.
What is the need behind this?
Maybe not the right partner.
Exactly.
Okay, so that leads me on to another question that I want to ask, which is about psychosis. So first of all, explain to people what psychosis is, and also explain to me what do you think is the number one cause of psychosis. Because in my hypothesis, again, I don't do this in a professional capacity, but from what I understand, it's going to be epigenetics. So who is around you, your thought process, your work, everything around, you know, down to even the things you're drinking, smoking, or eating. It could be all a contributing factor. Now, genetics, they do, we can't dismiss it, but I do believe that genetics are a loaded gun, and our epigenetics are what pulls the trigger. So how would you describe it?
Do you know what? So this is going to be purely from my personal opinion on psychosis, and it's also going to be from my personal experience on psychosis. So For me, psychosis, I split it into two different sections. And you've kind of actually really explained it really well. Yes, it can come from genetics. It can come from, and I'll tell you in a minute what psychosis is, but it can come from genetics. But it can also come from external factors. Now, when people ask me, am I psychotic? I ask them, what is your definition of psychosis? Right?
Precisely, yeah.
And they always say, well, it's when you go crazy. It's when you lose the plot, isn't it? It's when you have a breakdown. That person is psychotic. And I literally have to sit there and hold it in because I find it so upsetting when somebody says that. That is not psychosis. Psychosis is a mental state that unfortunately a lot of people go through. Now, it can be defined as genetics. It might be that, you know, somebody in your family or your genetic disposition, but it might also be from something that has happened to you. It can come from trauma. It can certainly come from, you know, recreational drugs. It can come from external factors, so things like influences around you. It could be that you are absolutely fine for 30 years, you wake up the next morning and you have a psychotic episode, we call it, right? So that might look like confusion, unable to speak, doing something completely out of the blue that you wouldn't usually do. So it might even be you start dressing differently, you forget how to brush your hair, for example. It might be that you don't remember your own name in that moment. It might be, I mean, there's hundreds of different examples, but the best way of describing it, it's a frame around you, an internal frame as well, that you can't justify why this behavior has happened. So the reason why psychosis is also quite dangerous is it can happen out of the blue. It can happen to anybody, right? So when somebody sees somebody crossing the street looking very confused, don't just assume that they are under the influence of something. They might be having a psychotic episode. So approach those people with caution because they don't know who you are. They can become very aggressive, but they might also become very soft and are very confused. So it's really something hard to approach. Most people with psychosis, unfortunately, have to be medicated whilst going through therapy just to help them get down to a level in a way where they can start to absorb some of the information and try and find out who they actually are as well. So it's a really sensitive topic, psychosis.
That makes sense. That's quite. Thanks for explaining that. I think it's a term that's thrown around loosely nowadays. It's super dangerous. Another term that's thrown around like excessively is narcissism. So traits. And I feel like the relationships that I see around, people have arguments, people have disagreements, people don't see eye to eye, which is going to be normal because they're two different people, and it's okay because you're making a beautiful family or whatever you are doing. You're still two people and no one is perfect. But I do see that this term narcissism is thrown around way too much. Now, I'm not sugarcoating this, that people don't have narcissistic traits. On some level, we all have those traits for self-preservation and survival purpose. But define this narcissistic, negative boundary and tell me what it actually is and define it for people, because I think a lot of people, both men and women, throw this around when they're just simply upset with their other half, which could be like something so simple as not picking up something or something so juvenile or innocent. It has nothing to do with that person. That person may also be driving their behavior from self-interest. But how do you actually differentiate between self-interest, healthy self-interest, and narcissism?
Do you know what, Sam? This is one of the probably the second most asked question I get. I have to say relationship counselling is probably number one still, but I get, again, countless of emails around narcissism, and I don't respond to those emails, and I'll tell you exactly why. Narcissism, that term, is being thrown around loosely constantly. In my opinion, It's a term that does not need to be justified. It doesn't need to be described. There shouldn't be something called narcissism. Because exactly what happens is, as soon as people get hold of a term, they will throw it around left, right, and center after an argument with their partner. You're a narcissist. You've got this. You've got that. But actually, what is it that we're talking about here? It's a need not being met. And because a need's not being met, it doesn't mean that that person is a narcissist, right? So that is the way that I justify it. Now, I know that's not going to be a helpful answer, so I'm going to go a little bit into more detail about that. When somebody says, my partner is a narcissist, the first thing they should be asking themselves is, what is happening in our relationship? Was he a narcissist according to your terms from the beginning? Was she a narcissist from the beginning? Is it that something's happened in their relationship and therefore they're both narcissists? So it's a lack of communication again, isn't it? It's why are you not talking about what the actual issue is and instead throwing terms left, right, and center loosely, right? Now, what we do hear a lot about is, I'm a counselling psychologist, so we don't like terms. We don't like labels. I want to know about your experience. Now, the way narcissism has derived is actually from a term of borderline personality disorders.
Sure.
So that is something we work with and something that psychiatrists might label a client as or a patient as. And then they come to see us because they want to learn to manage those feelings and emotions as part of the border personality disorder. Narcissism is a term that's been coined away from that to describe somebody who unfortunately is just not up to somebody's standards. It's a very poor term. So you will never hear us psychologists talk about narcissism. And if you do, let me know what psychologist that is, because I would like to know what their input on that is. But it's a term that nobody should be using. If there's something up in your relationship with your partner, let's talk about that.
And that's such a good point, that people are throwing this term around loosely, but they don't actually understand this. They do a quick Google search. Oh, this person is totally, right now I'm upset with this person, is totally a narcissist. When that person could just be focused on himself or herself.
Their needs.
Their needs, their emotional, their physical needs, their financial needs. And naturally, I think this is where a lot of problems also happen, because the right thing to do is to fill your cup first in order to be able to help other people financially, physically, emotionally. But if your cup is completely empty as a man or a woman, you're not able to amplify anything outwards. So therefore, their reliance on in any given relationship has to be accurately realistic. Because is this another thing that you do see, the over-reliance on the other partner for instant gratification or internal validation?
Constant. It's really interesting how, relationships, right? Clients that were in a relationship or are still in a relationship that I used to see, let's say 10 years ago, what their issue was back then is completely to the clients that I see now and what issues they bring in with. And it's exactly touching on the point that you've just said. A lot of people, I find, are in relationships now for the wrong reasons. Self-esteem boosts, money, all of this new social media virtual world that's been unfortunately created has come with the issues of people in their relationships. Somebody asked me this the other day, why is it that certain people, who, let's say our parents, so my parents are 95 and 75, they've been married for 40, 50 years, close to that. Why is it that they can deal with today's society issues and haven't divorced or broken up? And why is it somebody who has been with somebody for the last 3 to 4 years, got married, and are now looking to divorce? Very good question, right, Sam?
Very good question, yeah.
So the best answer I can give is, my parents are not part of the social media world. They see it, but they choose not to engage with it. They're not constantly needing to compare themselves to one Instagram post. They don't need to aspire to be that person that social media has created through a filter. They can be themselves. They don't need to have their partners boost their confidence constantly. They argue, they fight, but they make up and they work through their problems.
They work out, yeah.
Whereas the other side is, it's, I need this person because they do meet my needs. And like I said, it might be financial. It might be to do with that it does boost their self-esteem. It might be for looks, unfortunately. And therefore, they are with that person. But the problem with that is they're not with the person for the right reason. It's not out of love. It's out of, they are just providing me with 10% of my need, but not the remaining 90% of my need. And that's why those relationships break down. Because people will build up that tolerance. They will build up, it will build up until they're ready to burst.
Yeah.
And that's when the relationship breaks down. Is there hope in that relationship? Difficult to say, because that relationship was built on what the virtual world has been built on and not on the real world. So it's really hard to say.
That's such a good point, because I feel like the relationships which are not built on some of the fundamental values, i.e. trust, respect, and actually liking of the other person. You got to like that person.
Yeah.
Those relationships are just waiting to fail, because if it's built around financial structures, if it's built around sex, or if it's built around looks are going to fade away in time.
Absolutely.
Novelty is going to wear off, and we are at some point going to have a financial hiccup.
100%.
And if that happens, you need a partner who's going to ride through that with you.
I always say you need a ride or die. And the best way of justifying that is you need to go through the highs and lows in order to know whether that person will stick by your side or whether that person will stray or whether that person will leave you fully. And if you haven't got those fundamentals that you've just said about respect, especially, and trust, and self-love and loving the other person, there's no hope.
Yeah.
It's not something you can switch on and off. People are able to probably switch it on at the beginning of the relationship, but it will kind of reach a certain plateau and it will crash.
Yeah.
So anybody out there who is in a relationship like this, really look inside of yourselves and ask yourself, is this something I want to put up with for the rest of my life? Guaranteed it won't last that long anyway. Or is this something because I deserve better and they deserve better too?
Yeah, 100%. And this leads me on to, some of the people that I've experienced over the last 5-6 years, especially through lockdown. They've had some incredibly taxing times from an emotional point of view, and they have gone ahead and tried to use different masking agents as a coping mechanism. Alcohol, smoking, could be sex in certain cases, it could be food is another one that's used. So if you are now, you've gone down that route because you just want to numb the pain because the pain is so big, because there's another way out, which is inevitably to end your life, but people, most people know not to do that because it's a temporary phase. However, the coping mechanisms that people rely on, drugs, alcohol, and the things that we mentioned, if you are then hooked onto one of these destructive substances, where do you suggest people start?
Where do they start to get out of that?
Yeah.
Absolutely. Do you know what, Sam? It's so hard because they need to acknowledge that first.
They acknowledge it. So say for example,
So as an example, somebody who knows I have a problem, then the next question is, do they want to address that problem? A lot of people are aware of the problem. Come on.
And that's where they pull the pause.
And that's where they pull the pause.
Oh, wow, okay, yes.
People don't want to look internal, hence why they're numbing themselves through those addictions and through those different aspects, right? So this is also going back to your relationship question. What then happens to that partner? Do they drag them to therapy? If that person acknowledges the issue but doesn't want to work on it, there's no point. You can try and try and try, but until they're ready, and bear in mind, it's deep, it's painful, it's hard to look inside. It's hard to look at the person that you have become. And in a way, it's like a loss because they were not that person before. So you're kind of mourning the person that you used to be. And now, you're using certain influences and you're being created into a different person. But you're not happy being that person because you're just numbing yourself in those instances. But it's too painful to go backwards and looking at the problem. People want solutions. They don't want to work through the solution. They don't want to have that journey. They just want to be given the book. Here, this is what you need to follow and your problem will be solved. But what they don't want to do is, why has that problem even been created? And this is the dangerous part, is where people are shutting off and don't want to look inside and they don't want to address it.
Yeah, and they don't want to do the hard work. No. It's so painful to go through. It's hard. And this is where introspection is almost non-existent.
Yeah.
And because a part of this is suppressed by our hyper-stimulated social media accounts, where instead of just sitting down, putting your phone to one side, laptop to one side, people to one side, and just sitting in silence and not necessarily having to put on a bathrobe or light some candles, just sit and try to look inwards to see what's causing this much pain and how do you actually work through it. I think that level of introspection is missing, because once you can actually see your thoughts, then you can start to question those thoughts, then decisions you made, the decisions you haven't made. How do you actually try to course correct if you don't question it?
But the problem is, Sam, is people don't want to look into their thoughts. They don't want to look inside of themselves. It's too painful. It's essentially what they're doing is they're numbing their pain through, let's say, drinking excessively, recreational drugs, might be a sex addiction, might be any type of addiction that they've created. You're replacing one behavior with another. And this is the danger. It's until you not just see that, but you want to learn to deal with that and look inside, it will just continue and continue and continue like a snowballing effect. And this is why therapy is crucial, because therapy helps you to understand, why is it that I got to that stage in the first place? And somebody might say, well, my boyfriend broke up with me, or my girlfriend dumped me, or someone cheated, or in your example, lockdown. What is the point? I'm just stuck at home anyway. But actually, it's looking at, why is it that at home you couldn't do something different? Why is it that you didn't still have your social contact with people on a virtual basis? Why is it that all of a sudden you gave up on yourself, especially if it leads into an eating addiction? So lockdown isn't just the actual contributing factor. It's something else as well. And we need to look at that and address that in order to be able to stop certain behaviors.
Yeah, that does make sense. And it's very interesting. You personally are super social, and you have beautiful circle of friends around you, supportive, trusted people. And as humans, we are mammalian animals, creatures. We are herd animals. We like the community aspect. That's how we thrive. When you see your clients, would you say that there is a big difference between people who are in pivoting or remaining within isolation to the people who have got a good circle of family and friends around them? Do you think that plays a massive part?
Interesting. I'm just thinking of it from a perspective of, because we've got one extreme or the other here. I am quite a social butterfly, but I think what's missing here, Sam, is I am also quite a deep thinker, and I can be an introvert. And I like that. I like to have that time in the evenings where I just go and have a bath, where I leave my phone on the side. I am very social, but actually I'm on a social media break at the moment for 6 weeks. And for me, that's really important. And I really hope that people take example of that, because when you're constantly on your phone, speaking to people, you do not have that time to just self-reflect. You do not have that time just for your mind to wander, to drift off, to switch off and not think about anything, or think about something that might just pop up, randomly. So it's really important that you have the right balance of being social, but also that time to yourself. Now, where the danger is on both extremes is if you've got somebody who's going out 5, 6, 7 nights a week, who's constantly social and completely is not able to sit down in quiet and peace, practice some mindfulness and relaxation because they can't tolerate their own feelings and emotions. So it might be an avoidance factor. The same as you've got the other extreme, somebody who is not sociable at all, who doesn't have, let's say, a family support network or friends around them. So both of those extremes can lead into their own issues. And usually that's where depression comes in or anxiety comes in, is because they are so extreme on both scales that they just they're not able to find that balance in between the two.
That makes sense. And talk about anxiety and depression. I have seen so many people, and I've been there myself, in the deep of anxiety, deep anxiety, anxious moments, like 10 out of 10.
Right.
But it's not depression.
Interesting, yeah.
So how do you differentiate that? Because I see a lot of people suffering with very severe anxiety, but they're not depressed. So how do you pull the difference apart? And I think this is super crucial for people to know, because a lot of people are going around and saying, I'm depressed. So how do you actually pull a reference?
I'm going to switch that question around, Sam. What is your definition of depression? And then I will give you what my definition of depression is.
So my definition of depression would be someone who's given up wanting to make a change, but not able to influence their situation because the brain chemistry is now completely different. Brain is unable to produce the chemicals, whether that is due to PTSD. A lot of like people who've been to war, seen horrific things, seen incredibly traumatic events. They develop childhood trauma, childhood abuse, things that people haven't actually spoken about, and it's been suppressing, it's been building. And also those people, they haven't had any constructive endeavors where they haven't actually grown in any way. Instead, they've gone deeper into their anxiety, which has then subsequently led to depression, because they simply don't have the social structures to influence their very anxious situations, or those events have not been addressed. And because they haven't been addressed for such a long period of time, it has led to your brain now producing different chemicals. So now we're talking about clinical practice that's needed to actually intervene and help that brain chemistry, because your hormones and your neurons are operating in a completely different fashion. Anxiety, I would say, is more related with chronic stress, which is then producing chemicals of neuroepinephrine. So although where you're talking about in depression, you're talking about the suppression of serotonin, melatonin, oxytocin. When you're deep in anxious moments, although those things are happening, but they're not happening they're happening in spikes. But in depression, it's happening in a perpetual state, constant loop. Am I right, or would you say it's?
It's interesting because there's definitely 90% truth of what you're saying in terms of how the brain functions. And this is why a lot of people who are unfortunately struggling with depression need to go and see a psychiatrist for a prescription for some medication.
Sure.
Because it is the brain function and the way that's been changed because of the situations they've been in. Like you said, trauma is definitely one. And any type of events, they are unable to hold that. They're unable, their body goes out of control, it all spirals, and they need something to help them to keep them grounded. So this is where the medication aspect comes in.
Sure.
In my professional opinion and personal opinion, depression is defined as somebody who has been through something, So whether it is a trauma reaction or, something, it might be a change of circumstance. It might be something more current as opposed to thinking something that's happened in their childhood, and they're unable to tolerate it. They're unable to tolerate their emotions and feelings as part of that. And therefore, they then become in a mind or a mind frame or a mindset where they're unable to vocalize that. So they draw inwards and not outwards. They become maybe secluded. They might start to act and behave differently. They might stop doing all of the fun things that they used to do because they feel like they need to punish themselves as well because of that. So it can go to that extreme. So it's when you're really feeling, in English, shit about yourself.
Yeah.
That is what depression, in my professional opinion, is defined as. Now, where the other side comes in is somebody might actually be depressed and do the complete opposite. So they're going out loads, partying, the life of the party, but they're battling a deep depression.
That would be masking.
That is masking. Exactly that. So they're masking everything by this whole flamboyant persona that they are, but deep down, they're really struggling. And those are the dangerous ones, really.
This is where you see a lot of people overcompensating.
Yeah. And not just overcompensating, you see a lot of people do things that isn't something they would usually do. Spending on something. It might be booking extravagant holidays. It might be buying something for somebody completely anonymously or out of the blue, more like it. It might be going to do something that they usually wouldn't do. It leads often into sex addiction, actually. Completely different direction. It's because they are so unable to battle or confront what's going on internally that they feel that they need to mask it by doing all of these external things. They can still be depressed. And I know it's hard because a lot of people will say, Jesus, does that mean I'm depressed? The way she's just defined it. The question you need to ask yourself is, what is it that you have stopped yourself from doing? What is it that you're avoiding? And how has it been affecting your sleep, your eating? Has it affected how you speak to people? Has it cut you off from people? Start asking yourself these questions before just labeling it with a term of depression.
That's super interesting, yes. I think the comment that you made about people wanting to punish themselves, because I think in a lot of cases of abuse, they've never actually sat down with anyone and talked about this. So therefore, it must be me, which can quite easily lead to chronic stress and depression, and most definitely anxiety in many cases. Do you know if there are any biological differences between an incredibly anxious person in comparison to someone who suffers with chronic depression?
That's a really good question. I'm not sure what the answer is to that, but the way that I always look at it, when clients come in and say, I'm extremely anxious, but I'm not depressed, I ask them to tell me what it is that they feel anxiety is and how does that translate into what it is that they're doing.
Sure.
So I want to know about their thoughts, feelings, behaviors, and physical sensations.
Sure.
Once I've looked at all of those 4 points, I can let them know, yes, it is anxiety that you're experiencing, or is it just kind of like a panic attack that you're experiencing?
Sure.
Is it just actually something that is normal to feel anxious about? I always use this example with every one of my clients. When they say, what is anxiety? I say, if you're at a traffic light on a very busy road, you see cars coming from both directions, your light is on red, would you cross the road on red with cars coming towards you? Absolutely not. So what is holding you back? It's that anxiety. It's that feeling of, if I cross the road, this can end up very badly. If you don't have that feeling, that can be dangerous. So it's normal that each and every single one of us has some form of a component of anxiety within us. Now, where it spirals out of control is when it stops you from doing things. It's when you start thinking in certain ways because of it, when you start avoiding doing things, when you're unable to go and do something or communicate with somebody because of that anxiety, when it becomes crippling. That's when you need to go and speak to somebody about that. But it's normal for all of us to have episodes of anxiety.
Yeah.
It's normal for all of us to have episodes of low mood, because especially the way the world is nowadays.
Yeah, we can't always be happy.
No.
Everyone is chasing that constant happiness,
Yeah.
which doesn't exist.
It doesn't exist.
And even there's a bad name attached to cortisol, and you need it in the morning to get out of bed. So,
absolutely.
which would make perfect sense. So, okay, so moving on to relationships, or going back onto relationships, because it's such a hot topic. Why do you think people cheat?
Love that question. Can I answer that from a non-professional point of view?
Yeah, 100%.
Do you know what, Sam? The reason why people cheat is because they're just unhappy in their own life, and they're chasing something out there that isn't real. The best way of defining it, if you're in a relationship, obviously in order to have the word cheat, you must be with somebody. Why is it that all of a sudden that other person is more appealing in your eyes? Why is it that you're being drawn to somebody else? Are your needs not being met? Is it just sexual? Is it just the looks? What is it? What is it that's driving you to even seek out and go for somebody else? Now, don't get me wrong. Somebody might answer that question and say, well, I was sat in my office the other day and somebody walked in and my heart skipped a beat, right? And they wanted to experience and explore that further. Again, is it the adrenaline you're chasing, or is it the person you're chasing? And this is where the confusion lies, is that people are getting it really confused between feelings and something that is actually completely out of the blue. So are you just drawing yourself in by this next person because of how you're attracted to them? Is it because your needs are not being met internally? What is it? I don't know. I don't have the answer to that.
I think your comment of, are you chasing a feeling, or are you chasing that person, has just gone ahead and helped millions of people. Seriously. Because if a lot of people listen to this in just that one sentence is actually so powerful, because people are not chasing another person. Because logically speaking, people come with problems. No one is perfect. No one is going to be perfect for you physically, emotionally speaking. So when they are chasing the feeling of new, that's novelty related. So if you chasing that, it's only a matter of time that you're going to get bored of that second person, and then going to end up looking for third, fourth, fifth, sixth. So where does this chronic need for instant gratification and novelty stop? Because if you don't put a cap on it and you don't take a control over your emotions. Now, I'm not saying that you stop appreciating how beautiful people are. Yeah. But I think just be clear about the fact that you need to pull a pause after you have actually appreciated. Because you can appreciate and that's it. Observe, maybe even evaluate.
Love that.
Pull pause. Exactly. There's no need to engage further. I think that's super powerful. I think that people chase feeling rather than the person.
And the problem with that is that feelings can be very misconstrued. Because your feeling is based on a very temporary example or situation.
Yes.
So it's kind of like this. If you gave me a sweet right now, I would get a sugar rush, right? Yes. It's going to be temporary, but what happens after the sugar rush? You get the crash. It's the same thing when you're chasing that adrenaline rush. It will go up, you'll get the high, and then the low. So what do people do? They try and chase that high again, and then it dips again. It's the same as addiction, really.
That makes perfect sense. And okay, so driving someone's behavior through an influence and manipulation, again, they're completely two different things, right? Manipulation is done for self-interest. driving someone's behavior may actually involve some self-interest, but that may also be for greater good through influence, positive influence. How do you do that? How do you influence people's behavior at a greater capacity?
That's a very difficult question, Sam, to answer. I love that question and I hear what you're saying, but I think it's impossible to answer. Because if you really have the two that are completely different, what comes first?
Your manipulation of someone is naturally, that's something you want to avoid at all costs.
Absolutely.
Because that's all based on this, where you're trying to get someone to do something or act or behave in a certain way. I personally think, so this is where I'm going with this question, that if you see someone and you see abundance of potential, like endless potential from every point of view of their life, but that person, and I'm also, by the way, aware of the fact that you can't make people do things because unless they want to do it. But because you specialize in this, and this is what controls everything, are there any micro inputs that people can micro adjustments people can make to influence people more? Now, I know there are amazingly great books written about this and how to win friends and how to influence people and so and so. Nonviolent Communication is another good book. But how do you actually, are there any basic things that you can do in your day-to-day relationships, whether you're working with a colleague or you're with your clients or you're with your partner or you're with your kids or you're with your mom and dad, to drive their behavior, which is going to be to their benefit?
To their benefit? Well, if you're boosting somebody's confidence, that will lead them to their benefit, right?
Yes.
Is that what you mean?
All right. So start with the carrot.
Yep.
Drop in the stick. So I call it shit sandwich. So start with the beautiful bread.
Yep.
Drop in the bomb of a pile of shit, and then wrap it up with the sandwich bread. Right.
What a definition. I've heard a lot of analogies being used, but never that one, Sam. Start with the carrot.
Yeah, start with the carrot. So that way we are getting the message across in the softest way, in the nicest way possible.
Yeah.
Because it's reinforcing positive behavior, yet constructive feedback, and then end it. So they just don't know what's hit them.
Well, if you think about it from a child's perspective, right?
Yeah.
Positive reinforcement. What do you do with a child? Right? How do you make sure that they understand what is a positive behavior? And how do you make sure when a child acts out that it isn't an okay behavior? You start with the carrot. So you start addressing it. You start to talk about it, don't you?
Got their attention.
You get their attention and you talk to them about it and let them know. Well, it's hard to tell a child how that made you feel, perhaps, but it's turning that around a little bit. How would they feel if they were in that position?
That makes sense. Divorce rates and breakups, all-time high. Breakups and divorce rates are all-time high.
More than that, Sam. I think, in fact, we don't know how high it really is. The reality of that.
Okay, so if in your professional opinion and also hypothesis from a personal point of view, what do you think is the leading cause of that?
Of breakups and divorce? Communication.
Okay.
If you have a solid foundation, actually, no, let me rephrase that. A solid foundation is number one, but that is branched into different fields again. Communication, trust, respect, and all of the other things. So your question is, what drives all of that is not having a solid foundation. I do believe the media is creating a huge hoo-ha around what a perfect relationship should look like. Okay. And that could be the influence of why people break up and divorce. But also people are very avoidant. People don't want to talk about their problems. People want solutions to their problems, but they don't want to talk about the issue. So what do? They find a quick solution, which is called a breakup, or a very expensive one, which is called a divorce.
Yes, absolutely.
Now, what happens with that is the problem is unsolved. They go into a new relationship,
the same problem happens.
You really need to go backwards. and figure out what is it that's happening right now. Now, I strongly am a firm believer of, if you've been with somebody and you've always had a strong foundation, but something's happened, like a debt, let's say, or a situation of they lose their job, one of their partners, they think automatically, we cannot live like this, everything's going to be ruined, my life is over, we've got children or no children, but we've got huge expenses, therefore we just need to separate. That is not an answer.
Yes.
You need to work together as a team through any issues. If you can't work through an issue with a team, go and see a relationship counselor, go and see somebody and discuss that. Now, if you can't support your partner through these most difficult and challenging times, I would really question what it is that is even drawing you both together. Now, somebody might say, but why should I have to deal with somebody else's problems? Right? I get that a lot, believe it or not. Sadly,
100%.
I have built my own career. I have worked my ass off to get to the stage where I'm at. Why should I now make cuts purely because my partner has lost their job? But this is what a relationship is. I've never been married before, but isn't one of the vows through good and through bad? Through
thick and thin.
Thick and thin?
Yeah. Sickness and health.
Sickness and health. Fact is, those vows were written for a reason.
Must be a reason.
Right? But people don't want to believe in that. They feel a problem and they run away from it.
That's because the emphasis is on a wedding rather than the marriage.
And then you need to question why you went into a relationship with that person in the first place.
Yeah.
So if you haven't got that foundation, if you don't even like your partner, you really need to get out of that relationship, and it will do you both good.
Okay, so talk to me about the fact that when people stay in bullshit relationships and they know the other partner is either a chronic cheater or is doing things that, drugs, alcohol, just bad behaviors behind their back. But I see this with a lot of women, unfortunately, sometimes men, they're ignorant to what's going on. They're just like, they don't want to look at it because A, is too painful, B, is too expensive, C, is too inconvenient. But that's where they kind of leave it, and they kind of start to venture into their own bullshit. What is the impact of those microchronic stress markers on your brain health?
Whoa. What is the impact? It can lead to psychosis, believe it or not. Because if your brain is constantly under stress, under abuse, because what you've also said is recreational drugs and alcohol and all of the other things, as well as that influence from that person, you can develop trauma, you can develop psychosis, it can lead to a mental health breakdown.
What can that lead to?
Whoa. Unfortunately, the most extreme, sadly, is suicide. That's what it can lead to. But it can also lead to a number of other things: relationship breakdowns, divorces. It can lead to numerous addictions. It can lead to so many different things, mentally, physically, emotionally, socially, everything. I can't even tell you how much it can lead to because that's so much about it. You need to put a stop to it. You need to address whatever the stressor is, whatever the problem is, needs to be addressed. Otherwise, this is why so many clients come through my door, because they're unable to tolerate or sit with those feelings and emotions. They don't even know sometimes what's happening.
Yeah, that makes sense. And why do you think the suicide rate under the age of 20 has tripled over the last 2 years?
Even more than that, Sam, sadly, and even more prominent amongst men. The reason behind that is we are not speaking, we're not communicating, we don't want to scare other people, we don't want to hurt partners sometimes as well, we don't want to hurt family, we don't want to bore people with our problems. Unfortunately, that is the society that we've become. It's easier to not talk about it and not be judged, because fear of judgment is huge, and kind of let it eat you alive from the inside. And your only solution, unfortunately, sometimes what people think is their only solution is suicide, but that is not the answer. Suicide is never the answer, and it shouldn't be, but unfortunately it is.
Because it leaves a lot of pain on the people that you love around you. And this is quite interesting, because I strongly believe that in younger men nowadays, there's a complete lack of discipline and structure. Because you go on Instagram and you have 5,000 people, and on any given day telling you, listen, stay in your bed and make 50 million pounds from your phone, doing this ChatGPT hack. And I'm just thinking, I'm looking at that and I'm like, some of this may be true, but the problem is that you're encouraging super lazy behavior. And when you become so cognitively lazy in that capacity, then everything else is going to be impacted, because how you do anything is how you do everything. So then these young children, they are like, we don't need to put any attention or any love into our relationships with my mom, with my dad, with my partner. Everything is just convenience based, which is having a super detrimental impact too. So it's most definitely amplifying the negative side of how our younger generation is being impacted by this. What do you think? How do you think we should, as a society and also, as parents, reduce that gap between the distance that's being created between parents and teenagers at the moment? Because there's a big gap. Huge. And how do you actually, as a parent who is like, oh, I don't know what to, for example, my kid. I'm just like the gap between me and him is just growing and growing and growing, and there's such a disconnect that even having a basic conversation is a painful event now. How would you suggest to get closer to that?
So let's use the parent and child example, right? If you find that you're drifting away from your child because of all of these influences and things that are happening, it's easier said than done to say, go and sit down with your child and have a conversation. Find the interest of the child. Use that interest to have that conversation. So let's say they're constantly on social media, on their phones, they're not coming down for dinners, breakfasts and lunch, they're always in their room, online or virtual gaming. Just a wild example. Talk to your child about the games. Ask that, even though you might not have an interest in the game, ask them to explain the game to you, so that you can have that unity back. That actually, I want to hear, how does that game make you feel? And from that, a lot of unspoken words will be said. Because it might be that the child does not know how to communicate their needs and only finds to do so through these virtual encounters. So for a parent to understand that can be the opening door. So always go down onto the level of the child around what is it that they're doing, and speak to them about that. Don't attack them and say you're constantly out or in your room and you never have a conversation with us. We feel like we've completely drifted apart. That's attacking. Talk to them about what is it that they're getting? What fun are they having out of it? And start by opening up that topic.
And that's such a good point, because studying psychology for years but never practicing it in a professional capacity, I can relate to this, because the term of pacing and leading is so good, and it always works. Even in your professional capacity, it works. You pace the person, but you gotta pace them first. You gotta mirror, pace, and then lead them into getting them to open up more and have those open conversations. Why don't you drink?
Do you know what, Sam? Alcohol for me just doesn't work. I'm a bubbly person. There is nothing in alcohol. I don't like the taste. It has no influence on me. I mean, when I had a drink back before, it used to be vodka based, but why should I be absorbing all of these sugars and things when I don't even enjoy it? I can be the life of the party. I can be the non-life of the party. I don't need alcohol.
So what would you say to people who feel like they have social pressure to drink? And if they don't drink, they're not going to have some of the same relatability factors. Because when it comes to drinking and smoking, a lot of people who don't have a very strong personality to actually say, listen, I'm good, and they feel this pressure. So how would you say, like, some really basic but easy to implement narratives that they can say to themselves, self-narrative, to actually pull away from that?
You need to ask who your friends are. I don't think any of my friends have ever questioned me not drinking. It's something that I stopped a number of years ago. So if you are not drinking, you can still go out. If your friends don't respect that and are trying to get you to drink, you need to question who your friends are. If they are buying you drinks and you told them that you're not drinking, you really need to question who your friends are and let them know it's not helpful and that is your decision. And unfortunately, if they continue having these social pressures, you need to set boundaries. Stop that friendship group and create a friendship group with people who respect that. Yeah.
Pivot towards the proximity that you aspire to be instead of the people who drag you down and have destructive traits. Okay, so coming on to a somewhat controversial topic, there's incredible amount of confusion being caused. I'm not a conspiracy theorist, but at the same time, I see a lot of bullshit happening in our society where if you wake up one morning and you feel like a dog, you're a dog.
Yeah.
If you want to call yourself a cat, you're a cat. If you're a boy, but you feel like a girl, you're a girl. And naturally, there are like serious repercussions, consequences of this when powered by, the powers to be who want the society to somewhat go down this path, which is causing even more confusion. Although controversial, what do you think? What's your viewpoint on this?
What exactly are you getting at?
I personally don't agree with this. I think if you're born a girl, you're a girl. If you're born a boy, you're a boy. If you like Barbies as a baby girl, you like Barbies. If you like G.I. Joes as a boy, you're a boy, and there's nothing wrong with it. Now, at the same time, as a baby girl, if you like G.I. Joe, that doesn't mean you're a boy.
Yeah.
That just means that you like a different toy. There's nothing wrong with that. So, but what's happening right now is the over-sexualization and this narrative that's being pushed down. I think it's gone way too far down the wrong way. And I think people have started to wake up to this. UK just recently passed a bill that men cannot no longer compete in women's categories, which is great, I think, because a lot of women were unfortunately getting really badly hurt, especially in like kickboxing and stuff.
Oh, of course.
There's further, confusion where men are being just waking up and saying, I'm a woman, being transferred to female prisons, and thousands are getting raped on a daily basis. So there's that element to it. But even going down to being in your school and going down to as a boy you can go and use girls' bathroom. I think we are being pulled away from culture. We are being pulled away from some level of faith as well. The structure is missing. That combined lack of structure with lack of discipline, I think it's a very bad formula for a disaster.
The problem here, Sam, is it's, in my opinion, right? So this has nothing to do with my professional opinion. This is my personal opinion, is twofold. One of it is there's way too many labels and terms out there. And this is what's created that problem. Too much is being put out on social media. Too many terms are being coined. People cannot keep up with the amount of different labels are being created.
Correct. Yeah.
And that is the bottom of that for me. I can't keep up. My parents certainly can't keep up. And this is where the problem lies. Why is that happening? Again, it's how the social media has made it. in order to pull away from all of that, it's really hard to say, what do we do with that? How do we stop that? It's not possible, and it's only going to get worse. The way I look at that from my personal viewpoint is I try and understand what it is that person is feeling and who they identify as and what they want to be identified as. I try to put behind me who they are, and they need to tell me who and show me who they are. And that's the way that I accept people. And that's the way I relate to people. Now, if we all do it, pronounce names wrong or address somebody in a way that I thought is who they are, because sometimes what can happen is you might have an individual who was your best friend for 20 years. Let's say she was a female, and all of a sudden she has decided to be non-binary, as an example, which means they don't identify as anything but they. I would not know that until that they correct me or let me know about that. And this is where the problem lies, is that people make assumptions because social media, they identify as they, but they've never told me that. So this is where the problem is I need to be told, or at least introduced to what it is that you want me to label you as. And that is the only answer I can give to that.
No,
because it's too much.
There are too many categories now.
Way too many. So I don't engage with it. I will engage when somebody approaches me about it, and I'm very open in that aspect.
Yeah, in Austin, Texas, recently, it's like a girl took her daddy's car, a 13-year-old kid, driving on the main road. Police pulled her over, and she was like, well, I identify as a 19-year-old girl.
That's a very good example.
Yeah, so naturally this is creating confusion. There are books being introduced to preschool kids, like as young as 3-4-year-old gay BC, right? So at that age, they don't need to know any of that.
No, enough is enough. Enough is enough. I had this conversation with actually a friend who's got 2 children, and she's introduced me to that. I don't have children, so I didn't know. And she asked me, Sandra, what is your opinion on this? And I said to them, my opinion, my honest opinion on this is, why is it being introduced as early as 3 or 4 years old? I understand that we are in a world now where we have to be careful on how we pronounce things, label things, address things, but we're open to mistakes. And until somebody corrects you of how they want to be addressed, I don't think there is any concern. Or there shouldn't be. Unfortunately, the way the world is, they will make a problem out of it.
Yeah.
But, in my opinion, don't make a problem out of it until it is introduced.
Yeah, that's a good point. And going back into relationship optimization, I think you mentioned that communication is number one thing, which makes sense. Now, in any relationship, from experience and also by looking at people, there are always going to be some problems, right? Life is not perfect. There's going to be stress at some point in bigger or smaller capacity, right? We're humans, we live, and it happens. How do you keep the juices going and keeping the excitement flowing?
Love that. Absolutely love that, because this is the advice I love to give. None of the other conversations or topics that you've just covered.
Yeah.
You know what? How do you get the juices flowing? If you know your partner, you will know how to get the juices flowing. And I don't just mean that in the bedroom, Sam. I mean that. See what makes them tick. See what excites you about them. See what they get excited about you about, and use that to go and do something together. Date night, very important, especially when you've got children. You think date night's not important. Get dressed up. It doesn't even need to be expensive. Go and do a picnic in a park, as far as I know. But it's all about the time that you guys need together. That gets the juices flowing. I find it so attractive in my relationships when I can come with my own issues, and I do have issues, to my partner, and they come to me with their issues. And we sit down, and not kind of sat down at home in front of the TV to talk about it. We will take that problem external. We will go on a walk together. We will go on date night together, and people will say date night a problem, but it's about the solutions that you create, and that will give you that adrenaline. that will bring the excitement. Now, the reason why I'm smiling is I literally had that conversation with my partner last night. That is what brings you together. If you both can talk about issues and can talk about anything and laugh about anything and work through that, that is attraction. That gets the juices flowing. If my personal partner doesn't have that, I will not be in a relationship with them. That will bore me to death. Dear Lord.
Yeah, no, absolutely. That makes so much sense. And I want to ask, in your professional opinion, when you do see couples coming together and you can clearly see that there is problem, naturally one of the most crucial things, not the most, but one of the most crucial things is intimacy.
Yes.
Sexual chemistry and frequency. Very difficult for partners to actually sit down and have this conversation to say, you know what, this is what I want, say 3 times a week or twice a week or whatever. And hear what that person has to say, and then you meet in the middle where it's a sweet compromise. And that, I feel like that conversation needs to happen.
People don't have that conversation, unfortunately.
How do you advise people to sit your ass down and have this conversation? And what's the importance of it?
Absolutely. I think intimacy I am dumbfounded actually what a lack of intimacy is out there in relationships. Especially when I speak to people or my friends, so this is not clients, or my friends who are married or in a relationship or have recently got into a relationship. When I ask them the question around intimacy, it's, oh my God, it's such a chore. It's so boring. Like, I just rather do it, in a couple of minutes. He knows what boxes to tick, and that's that. That is not intimacy.
That's not intimacy.
That is not intimacy at all. So ask yourself, what needs do you need from your partner in terms of intimacy? What does that mean to him, and what does that mean to you? Or them. It doesn't need to be a her and a she, obviously, going back to the previous topics. 2 people talk about what it is that you need from that partner. If you haven't got that conversation at the beginning of your relationship, trust you me, it's not going to end well. So when you're already in a relationship, let's say, and it used to be brilliant intimacy, brilliant sex life, and it's stopped, you need to talk about that. Maybe the next opportunity is when you are feeling that you need to be intimate with that person, let them know what it is that you need. What needs are not being met and what needs need to be met. And hear your partner as well. Why is it that they're not meeting that need of intimacy? Is it because of stress? Is it because they can't be bothered? Is it because it's a chore? Is it because the children are asleep? Whatever it is it a work stress? When that is solved, when the problem's addressed, that intimacy should come natural. Because 2 individuals who love each other or like each other or in a relationship should have that need for intimacy. And if they don't, make sure you give me a call.
Excellent. Heavier question. What is trauma, and how would you describe the impact of it on people?
Interesting. So trauma, people think trauma is something that's happened to somebody like in the military who's experienced the war and witnessed something traumatic, and therefore they've developed trauma. They're right and wrong. It doesn't need to come from an extreme as a war, but it's a situation that you've witnessed or gone through that has caused you to start developing fears, start making you act different, start feeling triggered. Triggered here is a really important word. So the reason why you know if somebody has trauma or is going through something traumatic is because they'll be reminded of it at a later on stage through a trigger. As a perfect example, somebody who was in a car crash 30 years ago might be absolutely fine for 30 years, but all of a sudden they're in the car, or actually, let me give you a better example. They're not in the car, they're walking into a studio and a strong light hits them. That strong light might have reminded them of the headlights in that traumatic car crash. And all of a sudden they feel out of control. They become hot, clammy, sweaty palms, heart palpitations. They don't know whether to run away or cry or what to do. It completely throws them. They will start Googling. things, what is going on with me? And the internet has a very good way of labeling things.
Yes.
But one thing they might not label as trauma, because that person might not be able to relate it to any traumatic event from previously, because they might not know where that headlight reminds them of. And that's where trauma comes in. So it's any situation. It could have even happened a day ago, an accident, something that somebody said, something that they've seen on TV, something, it could be anything. It doesn't need to be extreme as a car crash or something they've physically experienced. Trauma can come from anywhere. And this is why it's so hard to understand trauma, because a lot of people don't know that it can literally be triggered by anything into something very minor even sometimes, but it can have a huge impact on them.
So tell me if I'm thinking of one of my really good friends, and he has childhood abandonment issues.
Right.
But he always has problems getting into deep relationships with his partners. So all of his relationships are very surface level. People can't get in.
Yeah.
So because in order to let someone in, you're exposing your inside to potentially a lot of pain. How do you navigate that?
He needs to want to work on that, because it's a really difficult therapy journey. He needs to find the right therapist, somebody he trusts, and trust is obviously built on communication. So the first step that I would advise him, if I may advise him to do, is, does he want to address it? Is he happy to just have superficial relationships, or is he actually looking for meaningful relationships? And if so, it will be talking about his childhood a little bit. It will be in a confidential space. Bear in mind, it's your therapist. Nobody will know about that conversation outside of the room. And once he talks about that, people are always scared to come to therapy because they think they can't really tolerate the emotions and the feelings. But that is the role of a therapist, is to navigate that with you. She or he are there, or they are there to help you with that and understand that. And once you've done that turn of understanding it, things become a lot easier. Therapy can be enjoyable, Sam. Therapy does not just need to be talking about all of these difficulties, you know? So yes, it might start off being difficult, but imagine the long-term outcome out of that.
Yeah, that's. I think a lot of people are reluctant because there's a persona to therapy with the old dude, white hair, sitting with the glasses on the sofa, asking you. I think it's from the movies and stuff what we make up, but I think the real world application of that is very different. And
so different.
Yeah, so that makes sense. Excellent, fantastic. If you could send one text message to the whole planet, just one message, and it's going to everybody, what would that message say and why?
Be you for you. That is the message. Don't be someone else for someone else, but my text would say, be you for you. And that is the message I want to say to everybody.
That's beautiful. I really like that last question. I know you read a lot, so we shared that passion. Now, out of everything that you've read, after all these years, name one book, which is very hard to answer, which has probably had the most amount of impact on your life.
It's called The Power of Wow by Monica Parker. That book has been life-changing. When you start looking at the world from your own lens, things will start to happen. All of these other books, The Art of Not Giving a Fuck, I find jarring again, because people read them and think, yes, I'm going to be that person, but I need the book to be written by somebody who has a knowledge base of what it is that they're even writing. And that, in my opinion, Monica brings out really well. So I'm not going to even reveal too much about the book. I hope everybody goes and gets the opportunity to read that book.
Yeah,
it's changed a lot of people's lives.
It's tempting to actually dive into explaining what the juice is in the book, but yeah, I'll definitely give it a read, and I'm pretty sure people will too. It's been a pleasure Thank you so
Sam,
much.
it's
This
been
is gonna
amazing.
it's gonna really have a huge impact if people listen to this, but most importantly, understand what you just said.
Thank you,
Been a
Sam.
pleasure.
It's been more than a pleasure being here today. I hope it changes and helps people who are stuck. Honestly, be you for you.
Roger that.